surgery is the failure of medicine. As a young surgeon, I took it as a personal insult. Now I have enough white hair to understand that this is true. We should do surgery when there's nothing else we can do. Because with surgery we cannot treat, we cannot improve tissue quality, which is one of the main problems in aging. So this applies to the neck too. I won't go back to everything that is presented, but let us remember that the mandibular bone is basically the main bony support that the neck has, and that loses a lot of volume. Number two, we have one superficial fat compartment between the skin and the platysma, and then we have what we call retroplatysmal fat. We have a deeper fat compartment. They both age, they both lose volume and quantity. And there's another thing that has been mentioned here that is of utmost importance in the neck, which is what we call in Europe retinacula cutis. The Americans call it fibroseptal system. And when we hear about tightening the neck with energy-based devices, probably in the rare cases when that works, this is the target organ. This is what is being reinforced. However, we have enough publications now, mostly in animals, that prove that hyaluronic acid can contribute to reverse this change in quality. Unfortunately, there's a misunderstanding, international misunderstanding, when people talk about biostimulatory fillers. Hyaluronic acid is left out of this group. Practically, it is not. We have enough evidence about it. The question is how you insert it, and I don't have time to prove the concept, but I'll just tell you that whenever we choose our injection plan, and instead of forcing our product through a needle, we put it where we want it, following the trail of the cannula, then precision can make a big difference. And when the product is diffused as a treatment, when we do an infiltration, a bit the way we put nano-fat grafts or micro-fat grafting, it makes a big difference. Okay, just about the proof about tissue improvement, collagen, elastin, etc. Remember that this is achieved by hyaluronic acid. It has been proven in animals. I don't think that a good study on humans would pass any Helsinki committee in the world, so I think we'll have to do with rats, but I think this is good enough for me. Let us remember that we still don't have them all over the world, but in Europe and in the Middle East, there are non-BDDE cross-linked hyaluronic acids, and so far, where is Tony? Yeah, and we have good evidence in vitro that these are the only hyaluronic acids that actually enhance adipocyte function besides fibroblasts without putting them to sleep. So this is just an anecdotal finding, and after this I decided to look into it, and I started infiltrating patients that come after they've tried everything. This is a colleague, she's 72, she has had a facelift, she has had threads, she has had every thermage-like device you can possibly think of. What is lacking here? Volume, okay? There's no reason to try to shrink and pull. This is not the best we can do. The best we can do is improve tissue quality and, by the way, restore the shape. Of course, the shape restoring is not going to be forever. It will need maintenance, but so do threads and so does surgery. Why? Because that volume loss is of utmost importance and it's always ignored. Okay? Now, if you think, if you don't have this product I'm not mentioning, you can either use non-cross-linked HA as a treatment, and or dilute your cross-linked fillers as far as the neck is concerned. Here you can inject a good volumizer, but as we've seen today many times, this periauricular fat compartment extends into the neck, and it makes no sense to start treating the neck without taking care of that compartment too. Today, even the masters of facelift will never abandon this area without restoring some of the volume with fat. Other cases, and what I wanted to show you is that unlike the whole brow forehead debate, this is quite universal. Where is the man? I don't have the man. I apologize. Yeah, I cut it out. But anyway, this applies to men exactly the same way. And in order to make it even shorter, the main difference for me is that when I inject the mandibular line for women, I put my filler under the mandibular line, whereas in men, I do it along the side. I hope this was short enough. Bon appetit, enjoy your lunch. Thank you for listening.